here for MarinHealth Cancer Care Services.
And so today we're going to talk a little bit about how to manage the emotional roller coaster of cancer in survivorship. Let's move to the next slide. There we go. So we know that just because cancer treatment stops, it doesn't mean that the cancer journey ends. Many people are left really unprepared to manage the ongoing physical and emotional symptoms that remain after cancer treatment. The most common concerns include fatigue, anxiety, body image, sexual health and functioning, infertility, a fear of recurrence, trauma and stress, and also family and caregiver distress. So Lauren and I know that each of these different concerns could take up an hour just to themselves, but we're going to focus today on a couple of the main issues that we see pretty regularly. So what we're looking at today is that, we know that anxiety can be at the core, really, of all of the concerns that I just listed. But today we're primarily going to talk about body image issues and the fear of cancer recurrence. And then we're going to take a deep dive into how to manage that umbrella of anxiety with cognitive behavioral therapy and mindfulness-based stress reduction. So body image. What is body image? Simply put, it is how you view yourself and what you believe about your appearance or your body. That can be even if it's not what other people see. So we know that cancer and the treatment of cancer can have many physical changes on a person's body, including hair loss, weight gain or loss, surgical scars, amputations, early menopause or infertility. Ooh, let's go back. A screen. Let's see. Oh, back. Some technical difficulties there. It can present as, like I said, oh my goodness. Apologies for the technical difficulties.
Can you hear me, Nikki?
I can.
So Lauren that's me moving the mouse around because Lauren is about to
Take over
my computer.
Oh, I see. Okay.
Sorry. Please continue.
Okay, fantastic. Let's go back a couple slides. If we don't mind, Lauren.
No.
The joys of Zoom. Okay. And one more. There we go. Okay, body image. So how are people's bodies impacted by cancer? Physical changes, like I mentioned, hair loss, weight gain or loss, surgical scars, amputation, infertility, decreased libido, muscle loss, neuropathy. And understandably, these changes can take a significant toll on how people view their post-cancer bodies. And it can lead to a lot of feelings of sadness, frustration, anxiety, anger, and isolation. One of the most surprising and enduring concerns for people who have experienced cancer is their hair loss and regrowth. When, and I'm speaking just in general terms here, when hair grows back after cancer treatment or chemotherapy, it can come back different than it was before. It can be thinner, there can be bald spots. Some people have experienced their hair being curly when it used to be straight. They can often, another body image issue is that people can not want to be intimate with their spouse because the changes that took place to their body during cancer treatment were upsetting to them. And as you can imagine, this can have a really big impact on their relationships and their overall body image as well. I also hear a lot of people that have concerns about lymphedema or swelling in their extremities, arms or legs, and how that can impact their body image, their self-esteem. When cancer treatment ends, most people just want their lives to return back to normal. And they can find that the changes that have happened to their bodies offer a constant reminder of what they went through during treatment. We'll often hear people say, I don't recognize my body anymore, or my body betrayed me, or I don't trust my body, or my body isn't my own. So how do we identify if someone is having issues with their body image? What does that look like? Well, it can be feeling ashamed of your body, not wanting to get undressed in front of a partner, or like I said, be intimate, or have other people see your surgical scars. It can be not wanting to go out because you don't want people to see you and ask questions, or feeling embarrassed by weight loss or weight gain. It can also present as excessive exercise, trying to get that pre-cancer body back to normal. What can you do if you're suffering from poor body image after treatment? Well, I think it's really important to really allow yourself time to adjust and be kind to yourself. Surround yourself with supportive family and friends. Seek out counseling support from social workers or therapists as needed. Attending support groups with other people who have experienced similar things. Staying active can be helpful, and accessing resources that might be able to help, like the American Cancer Society's Look Good and Feel Better program, among many other things. And of course, it can lead to anxiety, which we'll talk about in a little bit. But the other really common concern that I hear about is the fear of the cancer coming back. And it's one of the biggest worries that we hear about from cancer survivors. As you can see, it's defined as a fear, worry, or concern relating to the possibility that the cancer will come back or that it'll progress. It is one of the most common unmet needs of individuals in cancer survivorship, and up to 78% of survivors and people with cancer reported having this fear. So what are some triggers that what are some triggers that can cause fear of cancer recurrence? Well, it can include treatment anniversaries, diagnosis anniversaries, regular scans and having scanxiety, or the anxiety associated with scans or test results. It can also be caused by the changed frequency of doctor's visits and follow-ups, and the worry that things aren't being monitored as closely as they were in treatment. So what does fear of cancer recurrence look like in real life? It can be as simple as having symptoms that led to the diagnosis of cancer. For example, if someone went to the doctor with back pain and later got diagnosed with cancer, anytime that individual has back pain could be a trigger or a worry that the cancer has come back. And for a lot of people, they were unaware that there was anything going on in their body until they were diagnosed with cancer. So feeling well is not a feeling that they can trust. The reason that we talk about fear of recurrence is because many people may be experiencing situations like these and not know what it is or why they're feeling that way. Having a fear of cancer recurrence is very normal and natural, and the treatment for it includes early recognition, knowing what it is, naming it, and being able to normalize and validate those feelings. It also helps to have a detailed and thoughtful follow-up plan with your healthcare team. So when we talk about the anxiety related to body image issues and having fear of cancer coming back, what can we do about it? And that's where I will hand it over to Lauren.
Thanks, Nikki. Everybody can hear me okay? I apologize for the technical difficulties earlier, and my notes are now on my table instead of on my screen. So if I'm looking down, I'm trying to just make sure I give you guys all the good info. So as Nikki mentioned, I think the idea of body image issues and fear of recurrence can, I would argue, fall under this sort of larger umbrella of the idea of anxiety in survivorship. Anxiety at this point is a wholly mainstream concept. And the more that we learn about anxiety, the more we know that it can really span the entire lifespan, from little kids all the way through our later years. So when we think about how do we tackle anxiety and survivorship, the things that I really want to go over today are two different approaches to how to address that anxiety. The first is a widely researched and practiced therapeutic model called cognitive behavioral therapy. It is one approach to anxiety that typically will be done in a therapeutic dyad between a patient or a client and a therapist who's trained in CBT. And then the second approach that we're going to go over is called mindfulness-based stress reduction. And that's meant to be a skill that certainly can be practiced in a dyad or with a group, but is a little more accessible to folks in that it can also be widely practiced on an individual level in a personal sort of setting. So this slide is really about our first approach, which is cognitive behavioral therapy, or CBT. Now, CBT is considered what we call a psychosocial approach, in that it looks at both behaviors and thoughts and combines foundations of behavioral and cognitive psychology to address anxiety, thoughts, emotions, behaviors, any of these things that end up being maladaptive or interfering with a person's sort of day-to-day functioning. Now, because it can be really hard to change our feelings, how often have you been able to say, stop feeling sad, and have that work? CBT really looks at the connection between thoughts, behaviors, and emotions with an eye towards identifying how those three things can influence each other and finding the most realistic place to insert new tools to effect change to all three of them. CBT ideally, or at least the way that I'm going to be talking about it, is seeking to change your thoughts and have that then influence a change in your behaviors and your emotions. CBT as an approach is very problem focused and action oriented. It's really meant to say, let's look at our overarching situation, that relationship between our thoughts, feelings, and behaviors, and figure out how we can make some real and meaningful change in one of them to influence meaningful change in the others. Next slide, please. So when we think about CBT and its way of addressing anxiety in survivorship, one of the things that we see most often is the idea of what we call cognitive distortions. And these are essentially maladaptive or unhelpful thoughts that occur pretty regularly and in ways that interfere with a sort of a satisfactory way of living your life. Anxiety, just, to have it on the slide, right? The general definition that we're working with is an emotion that's associated with worried thoughts, feeling tense, and then various physical changes in the body, like an elevated heart rate or difficulty focusing. And really, when we think about anxiety as a human response, it can actually be very functional. Functional anxiety is the idea that you're nervous about, for example, arriving to the airport and not wanting to not miss your plane, right? Functional anxiety is going to drive you to make plans to arrive with plenty of time and ensure that you're not going to miss that plane. It serves a function. It helps you get through your day and accomplish your goal of getting to the airport on time to catch your flight. Now, anxiety can just as easily become truly dysfunctional. And that's when the response to stress is out of control in a way that impairs our ability to solve problems. And dysfunctional anxiety can lead to avoidance, physical manifestations of stress, and also just impair the ability to sort of function in everyday situations. As I said, one really common manifestation of dysfunctional anxiety are cognitive distortions, which are automatic negative thoughts that can influence our behaviors and our emotions. So some of the most common ones are all or nothing thinking, jumping to conclusions, or minimization or magnification. Say that 10 times fast. And cognitive distortions generally are initial and automatic thoughts, as I said, that tend to negatively influence behaviors or emotions. And in those moments, it's important to really recognize that when we are in intense situations or under a great deal of stress, our automatic or initial thoughts might not actually be rational, helpful, reasonable, or factual, hence the term distortion. So when we think about cognitive distortions, some of the examples or some of the ways that I would describe the three examples that we have on the slide, let's just sort of walk through them to see that you understand what they look like in real life and potentially have experienced them yourself. So jumping to conclusions. Jumping to conclusions is the idea that you're making a negative interpretation of the situation when there are no facts or evidence to convincingly support your conclusion. So the idea of, I haven't been feeling great, and I know I have an upcoming scan. If I haven't been feeling great, it must mean that the scan results are going to be bad, right? The fact that you may be feeling bad has no direct correlation to what are currently unknown scan results. You don't have the ability to know what's going on a cellular level in your body. So it's a bit of a jumping to a conclusion that you think that feeling bad, say a stomach ache or a headache, automatically means your scan results are going to be bad. You've jumped to that conclusion. Another example of all or nothing thinking in absolutes or black and white categories like always, never, or every. So an example of all or nothing thinking statements can be, I never do a good enough job eating right or exercising, and I'm sure it'll cause my cancer to come back. Now, to say that you always eat poorly or you never exercise, those might be true in some interpretations, but there's probably also some gray area in there that you're not really allowing for because your anxiety is focused on these extreme ways of looking at how you live your life day to day. And then the third one, magnification or minimization, is the idea of exaggerating or minimizing the importance of events that take place. So an example of that kind of cognitive distortion would be to say, I missed my follow-up appointment with my doctor, and now I am totally off track with my care and my follow-up. We all know that missing one single appointment is not an entire history of your medical care. And while rebooking in this day and age can be difficult, missing one appointment does not mean that the rest of your care forevermore is going to be off track. So these are some examples of cognitive distortions. Can we go to the next slide, Nikki? So what do we do about cognitive distortions? Well, in CBT, the primary way of responding to cognitive distortions is something called cognitive restructuring. And it can be best summed up by the phrase on this slide. You don't have to settle for the first thought that pops into your head. What that means is that what cognitive restructuring aims to do is adjusting your thoughts to have a more positive outcome on your emotions and your behaviors. But to do that, you first have to say, I'm not going to settle for the first thought that pops into my head. So cognitive restructuring is all about identifying the thought and what kind of distortion it is, questioning it or challenging it, and then replacing it or restructuring it with something that's more accurate and more helpful. So we're going to try an example right now. Nikki, do you have an example that you would like to use of a cognitive distortion that we can apply this cognitive restructuring to?
Sure. So I think, one of the examples that I used was, having back pain and how that led to a cancer diagnosis. So, something along those lines would be, I've been feeling really nervous this week because my back has been hurting and I have an MRI coming up.
Mhm.
I'm worried that the MRI is going to show that my cancer's come back.
Mhm. Great. That's a perfect cognitive distortion to use for this example. So what we want to start out with is identifying the anxious thought and naming the distortion. The statement that you gave us, what I would say is the anxious thought is you're really nervous that how you're feeling in your physical body means that your scan results are going to come back badly, right? That's the distorted, or that's the anxious thought, is you're nervous that how you're feeling right now and today is going to have an impact or have an implication on what the scan results are going to be. Now, the distortion is what I would label it as jumping to conclusions, right? You're saying that how you feel in this present moment must mean that your cancer has come back and that your scan results are going to show that. So let's think about what the evidence is for that. Let's question and challenge that thought a little bit. Are you basing that thought that you feel bad, so your cancer must have come back, on facts or on feelings? I would say that you're probably basing it on feelings, right? On your feelings in your physical body, but also the fear that you're having about cancer recurrence in general. Feelings are important, but they are not facts, right? So think about what else can we say about this distortion? Is it a likely scenario or is it the worst case scenario? Are there any indicators that you have that how you're feeling in the present moment actually means that your cancer has come back? Now, certainly we can't unpack that in great detail unless we were thinking about a particular case or a particular patient and all of their medical history. But suffice it to say, I think it's reasonable to at least question and challenge the thought with the idea that you don't necessarily know what the scan results are going to show. You just don't. We don't have scans in our own bodies. We don't have our ability to look at ourselves in the mirror and know what's happening on a cellular level. So it's worth at least pausing that thought to say, do I have any facts to support that my scan results are going to come back? I would argue in this moment, not really. And then one of my personal favorite ways of challenging a cognitive distortion is, what would you tell a friend in this situation? I think we see this all the time and often throughout adult life, that we tend to be harder and harsher on ourselves than we ever would be with a best friend. And so the recommendation that I have is, if your friend came up to you and expressed these concerns, what would you say to them? I would hope that you'd say something along the lines of, take a couple deep breaths. We don't know the results of the scan yet. And I'm here for you to hold your hand until we do. So really just leaving space to be kind and gentle with ourselves until we have more evidence to support our concerns. So that's an example of cognitive restructuring. I think while the example that we used, we often will term scanxiety. Like, a lot of people can be really nervous about upcoming scans in the survivorship and follow-up phase of care. It's very common, and hopefully it gives you guys some ideas and some language and some tools of how to respond to those automatic negative thoughts. Identify what's distorted about it, question or challenge it, and do our best to restructure it with something or replace it with something that's a more helpful thought or narrative. Next slide, please. Okay, so the idea of CBT is a modality that is often facilitated with somebody else, with a therapist, with a trained facilitator, knowing that a lot of people don't have therapists or trained clinical providers at their beck and call. We felt like it was going to be really important in this presentation to also offer you something that is a little more personal and individualized. And what we wanted to highlight is this idea, this concept of mindfulness-based stress reduction, or MBSR, as an alternative to CBT in how you can respond to some of the anxiety you might be running into in the survivorship phase. Now, mindfulness is a term that has gone totally mainstream at this point. You see it everywhere. And the idea of stress reduction is also something that we see readily in our health landscape these days. We all get the sense that reducing stress has concrete health benefits. What you might not know is that mindfulness-based stress reduction is actually an approach that's been around since the early 80s. It's been studied and researched since that time, since its inception, and is actually something that is widely understood to have very concrete and significant mental and physical benefits to those who are able to practice it regularly. So the sort of grandfather of mindfulness-based stress reduction is actually a physician himself, or a professor, John Kabat-Zinn, who started his MBSR program as an 8-week course at the UMass Medical Center for patients who were beyond the help of other specialized care at the time. So these were patients who had chronic pain, chronic depression, symptoms from chronic illness that were not managed by those specialty doctors that they were seeing, and were basically beyond the help of sort of standard specialized medicine at the time. And what John Kabat-Zinn did was bring in these other practices and the influences of a lot of Eastern medicine to a Western medical research setting to see what kind of results he got. And what came out of it is what I would argue is today a pretty far-reaching embrace of MBSR as an effective approach to dealing with stress and anxiety and a lot of physical symptoms that people might be experiencing going through other healthcare journeys. So the very first word, the most important part of mindfulness-based stress reduction, is the concept of mindfulness. Now, again, we see this a lot in mainstream media, in society and healthcare. But what is mindfulness? A lot of people don't actually know or have a definition of mindfulness. So the definition we're working with is a non-judgmental acceptance and exploration of the present state, including the physical, mental, and emotional experience a person is having. Mindfulness-based stress reduction seeks to bring in that awareness and acceptance of your present state as a process of cultivating the skills to better choose our responses to stress triggers. What does it do to cultivate that space? It uses elements of yoga, mindfulness meditation, guided imagery, and often a lot of breath work. So mindfulness-based stress reduction as a whole is something that uses multiple tools to find benefit, but all of them are based on this idea of mindful, non-judgmental acceptance and exploration of a patient's experience. So not judging how you're feeling, not telling yourself you should or shouldn't feel a certain way, but simply sitting with the experience and exploring your response to it. Sort of a long-winded way of giving you an idea of what mindfulness is all about, because it really is the foundation of MBSR, regardless of the practice you're using, whether that's yoga, meditation, or breathing. So next slide, please. What I'm going to do today is go over 2 different really common MBSR practices, and that's going to be breathing and then also guided imagery. So when we talk about breathing, it is one of the most fundamental tools that MBSR uses. And part of that is because breathing and breath work has actually got incredibly strong research behind it to show a very meaningful and often quick physical response. Breathing is often so automatic that we do it without thinking. And what MBSR does is actually ask us to reflect on the potential for breath work to calm and center us, both physiologically and mentally. So diaphragmatic breathing, or what we call belly breathing, is a practice whereby you're breathing deliberately, right? Breathing is something that we do all the time without even thinking. MBSR and diaphragmatic breathing focuses on the deliberate and purposeful act of breathing with an eye towards eliciting a physical response. So what you do, and we can practice it in this meeting, in this workshop, if you'd like to sort of breathe along, if you will. And what it does in belly breathing is that you fill up your lungs, and in the act of doing that, your belly extends forward. So instead of breathing up with your shoulders, like, you're actually breathing more out with your belly. And it can be helpful if you put a hand on your belly while you do it to sort of make sure you're feeling your body going through those motions in the ways that we're hoping they will. So what I would challenge you guys to do is get comfortable, whether that's laying down or sitting up, and place one hand on your upper chest and one on your belly. What I want you to do is breathe in deeply and slowly through your nose, feeling your belly or abdomen fill up with air and extend. Do a couple more. So you've got the inhale. Now, when you're exhaling, I want you to purse your lips like you're blowing through a straw and exhale slowly and fully through your mouth while your belly or abdomen contract or are drawn back in. So like this. And get into a rhythm that feels comfortable and natural for you. I'm doing my own. I trust that you're able to do your own as well. But one of the main things that we try to do with diaphragmatic breathing is do it for a somewhat extended period of time, not just 3 breaths, more like 2 or 3 minutes of that sustained, slow, deep inhale with your belly extending, and slow, mindful exhale through pursed lips while your belly contracts back in. Now, if you'd be willing to keep doing that while I continue talking, I would love to go over some of the benefits that diaphragmatic breathing offers. In MBSR, one of the important ways to practice diaphragmatic breathing is to try and extend the exhale a little bit longer than your inhale. So if you're counting, maybe you inhale for 4 breaths, try exhaling for 6 or 8. The numbers are less important than the effort of drawing out the exhale for a longer period of time, assuming it's physically comfortable for you to do so. Now, the benefits of MBSR are really pretty impressive. A lot of the research shows that it can actually lower your heart rate and blood pressure. It can increase the oxygenation of your blood, which in turn feeds your organs like your brain and your lungs and your nervous system. And it can also really reduce the levels of stress hormone in your body. One of the most amazing things about diaphragmatic breathing is those types of immediate results that you can see on your cardiovascular system, on your respiratory system. And this is because diaphragmatic breathing actually activates the vagus nerve, which in turn triggers the parasympathetic nervous system and your body's relaxation response. So diaphragmatic breathing can quite literally trigger your body to relax. My personal favorite facet of diaphragmatic breathing is that it's accessible anywhere, right? You can do it in your bed, you can do it in your car, you can do it in line at the DMV. Anytime, any place you feel your stress or anxiety rising, diaphragmatic breathing is a tool that you have at your disposal to meaningfully trigger your body's relaxation response. So it is one of my favorite tools. Even if I knew nothing else about MBSR, it's one of my favorite tools to address a stressful response to life in today's current climate and society. One of the big factors of MBSR that we talk about and diaphragmatic breathing that we talk about is to practice little and often. So this is something that we encourage you to do for small periods of time, multiple times a day if you can. Building in 5 to 10 minutes each day to do this practice is actually something that ideally would show positive emotional and physical outcomes, not just right away, but in a lasting way, the more often you can do it. So we want to make sure that it's something you can consider doing, certainly in this practice or later today when you get off the workshop, but also really something that you can try practicing or working into your daily practice, your daily life every day. So maybe that looks like setting a timer when you wake up and doing 5 minutes of diaphragmatic breathing before you even get out of bed. One of my personal favorites is to do it once I'm in bed at the end of the night, and rather than just sort of closing my eyes and trying to fall asleep, which I don't know about you, but that can be pretty hard sometimes. Diaphragmatic breathing, again, triggers your body's relaxation response. And I would argue makes it a little bit easier to fall asleep into a helpful and beneficial level of sleep. So when we think about workability, when we think about trying to take new practices and integrate them into our daily lives, one of the main things that's so important is that you do it in a way that's realistic for you. So if you have to get up at 5 a.m. and get straight in the car to get to work, doing diaphragmatic breathing might not be the most accessible thing when you're busy trying to get out of the house. But are you stuck in a commuter traffic to get to your job? Would that be a good time to try it? Other examples would be trying to tie it to something you already do every day, like walking the dog or taking a shower. When we talk about integrating new practices into your life, it's really important to try and pin them to things that you're already doing, so you're more likely to be able to do them rather than trying to rework your schedule to make it happen. So that's diaphragmatic breathing. That's like a foundational MBSR breathwork practice that hopefully is something that's accessible enough that you can try integrating it into your life in small and meaningful ways moving forward. Next slide, please. So the next MBSR practice that I want to talk about is meditation and guided imagery. Now, breathing, everybody can do it. Everybody has to do it, right? That's not very hard. Meditation, a lot of people find that much more difficult. It's a much taller order. When we think about our initial definition of mindfulness, we're reminded that it's all about awareness of the present moment. But staying present can be really hard. You might not be able to do it very often. I think this day and age, we have a million different stressors, a million different triggers, things asking for our attention at every moment of the day. So calming and quieting the mind and bringing it to the present moment is not always that easy. Some of the common obstacles to staying mindfully present are wanting to be somewhere else or doing something different, resisting. Thoughts or feelings come up that are uncomfortable or scare us. We really don't want to sit with them for all that long. Or restlessness. And with a mind that wanders or a body that feels like you have constantly to be doing something else, it's pretty hard to stay mindfully present. So what I want to convey is that it is totally normal and completely common to struggle with mindfulness at first. We are not in a society that values, cultivates, or supports the idea of sitting quietly to collect our thoughts, right? We're just not. But that doesn't mean we can't do it. It just means it takes a little bit of practice and probably some dedicated time and attention. So even though staying present can be a challenge, even when we're motivated and committed to the practice, one of the ways that I think is important to acknowledge is that not everybody is going to be able to access meditation in the same ways. So I'm trying to offer you guys 2 different examples of meditation that may make it more accessible and more realistic for you to access if you're interested in trying a new practice. So the first one is called a sitting meditation, and this one tends to be a little bit longer, a little bit more involved, but ideally the way I'll describe it is going to give you some structure that helps make it a little bit more accessible. So when we're doing a sitting meditation, it's important to get into a comfortable position, whether that's sitting, some people it might be lying down, and you use your breath, that diaphragmatic breathing that we talked about, as the beginning and ending focal point. So maybe you sit there for a few minutes, do 3 to 5 deep, slow breaths to just center your mind, your thoughts, your body on the practice that you're embarking on. And then you would spend 10 minutes. Some people want to set a timer. We're going to talk about other tools to use to support meditation after this. So you spend 10 minutes, and the goal of a sitting meditation would be to move your awareness deliberately through sort of a cycle of foci. So maybe you start with sensations in the body. How does it feel to be sitting here? Where's my weight? Are there any tension in my body? Am I noticing my posture or how I'm carrying myself differently in this moment? Then, once you've done what could essentially be called a body scan, noticing what's coming up, how you feel about it, why that might be, then we turn our attention to the environment around us. What do I hear? What do I smell? How do I feel where I'm sitting? Am I on a hard surface or a soft surface? And really taking in as much as you can about the environment around you. Then you want to move your attention to the thoughts that you're having. Are you able to focus? Are you thinking about something else? What else might you be thinking of, and why? And what are you thinking about the practice of meditation in and of itself? And then finally, you want to go to moving your attention over to what emotions might be coming up for you during this practice, earlier in the day, in this moment, what you might be feeling later in the day. But really sort of sitting with and naming the emotions that you're experiencing in the moment. Now, often minds wander. That's what they do. That's how we're wired. What can be really important about a sitting meditation is to not judge yourself for having a wandering mind. Instead, accept that it is simply going to happen. And when it does, when you notice it, bring yourself back to your breath and anchor again in that moment, in that physical experience, and then continue on with wherever you are in the cycle that we've talked about. So that's a sitting meditation. That's something that tends to be a little more traditional. When you think of meditation, you might think of somebody with crossed legs and, candles and incense. Sitting meditation that I've reviewed is a pretty good example of something like that. Hopefully it's something that seems a little more accessible. You don't have to have years of meditation under your belt to be able to try 10 minutes. But I can tell you from experience that it takes time. It takes time to develop a comfort or a sense of meditation. And so one of the things that I really try and encourage people to do is set yourself a goal. The one meditation might not work for you. See how you do if you're doing it once a day or once every other day, and give yourself a week or two to see how it feels. The second type of meditation is called a stop meditation. And this one is much shorter and meant to be similarly sort of guided and structured, but you can do it walking to the grocery store. You can do it walking your dog. You don't have to be in the calm, quiet space to be able to access this type of meditation. So a stop meditation should ideally take between 1 to 3 minutes and is best applied to the moment right when you find that you're struggling with a thought, emotion, or activity or behavior in the present. So STOP is the acronym. S stands for stop and take stock. Get out of autopilot and ask yourself in this moment, what am I experiencing right now? What am I feeling? And how would I articulate what's going on for me in this moment? The T is take a breath with mindful attention, or a series of them if you need to. But again, that idea is you're grounding yourself in your breath. You're triggering that relaxation response, and you're bringing yourself into the present moment. O is open up and observe your field of awareness. So similar to the cycle of attention that we'd had in the previous meditation, think about in the moment, your bodily sensations, your surroundings, and your feelings. Again, this is in total a 1 to 3 minute practice. So you don't have to do a deep dive, but it's really important to be honest and vulnerable about how you're feeling, what you're thinking, and what's going on in your body. And then the P is proceed. Reflect on the situation and how you would prefer to move forward, right? I talked in the beginning about the idea of cultivating space between a stressful trigger and our response to it. That's what this is meant to do. It's literally meant to stop you, pause long enough to fully discuss, accept, identify what it is you're feeling, and then proceed with the idea of how would I like to be doing this differently? How would I like to change my response or my attitude or my thoughts or my actions? And if you can identify an alternative, a preferred way of moving forward from that moment, go for it. So that's the stop meditation. The idea of meditation in general, for a lot of people, is really inaccessible. It feels daunting. It feels unnatural to sort of stop and really focus on being still and aware. But if nothing else, our hope for you taking away things from this workshop is tools that are accessible to you, tools that you can access internally, externally, within the people and the skill set that you already have, or within new ones that we're going to make you aware of. So one of the things that's really important about meditation is that workability of it, is the accessibility of it. Not everybody has a studio they can go to that's quiet and calm. Not everybody even necessarily has a meditation resource in their community that they can identify. So one of the things that we want to make sure of is that you feel like there are really truly accessible tools to you. We've gone over a lot of information today. I don't expect that anybody has absorbed all of it. But if nothing else, we really want to convey to you that there are tools available to you to use out in the community with modern technology that hopefully will support either the idea of working in a dyad, in therapy, with somebody facilitating some of these skills, or that you can use to work on them yourself, individually and internally. I'm going to hand it off to Nikki to share some of what these tools might look like, and hope that you're going to be learning something new right now, because it's pretty exciting, all of the tools we have available to us today.
Thank you, Lauren. That was fantastic. So I know most people, not everybody now, but most people have a smartphone, and I know it can be hard for me to remember what I'm supposed to do when I'm thinking about meditation or breathing, and we get busy and forget. So one of the easiest ways to remind yourself is to have an app, like the Calm app or Headspace, I think are two of the most common ones. But also UCLA has a Mindful app. Oh, let's go back. Oh, wrong direction. We'll get the technology figured out eventually. And I think, as some people mentioned in the comments, UCSF has fantastic resources as well. They've got classes and resources online, as does MarinHealth. And of course, we at MarinHealth here have the Integrative Wellness Center, which is an incredible resource that offers massage, acupuncture, mindful meditation, and those tools as well. I know some of the apps do have a cost to them, but most of them will have some free meditations that you can do that don't have a charge for them. And UCLA's app is free, which is even better. There we go. Now we're ready for the summary. So what we went over today really is just trying to help everybody normalize the emotional roller coaster of cancer survivorship. You know, we talked about a couple of the common issues that come up in survivorship, dealing with body image, the fear of recurrence, And then Lauren went over 2 different approaches to managing the stress and the emotional ups and downs that come from a cancer experience, including cognitive behavioral therapy and mindfulness-based stress reduction. So we did go over a lot of information. We do have, if people are wanting handouts, hard copies or emails, we certainly have more information that we can get to you all and to help you in your CBT and MBSR learning.
Thank you so much, Nikki. I thought that we could start I thought that we could stop and close out with a poem that I think really identifies a lot of what we're trying to do as we walk through new and difficult experiences. I hope you like it. It's called An Autobiography in 5 Short Chapters by Portia Nelson. Chapter 1, I walk down the street. There is a deep hole in the sidewalk. I fall in. I am lost. I'm helpless. It isn't my fault. It takes me forever to find a way out. Chapter 2, I walk down the same street. There is a deep hole in the sidewalk. I pretend I don't see it. I fall in again. I can't believe I am in the same place. But it isn't my fault. It still takes a long time to get out. Chapter 3, I walk down the same street. There is a deep hole in the sidewalk. I see it is there. I still fall in. It's a habit. My eyes are open. I know where I am. It is my fault. I get out immediately. Chapter 4, I walk down the same street. There is a deep hole in the sidewalk. I walk around it. Chapter 5, I walk down another street. Thank you all for joining us today. We hope you enjoyed it. We hope you are able to take something away from it as you walk through your own survivorship experience. And now we have, I think, a few minutes left for any questions that people might have about the material we've covered today. I think if you need to, you should be able to raise your hand. The controls are usually down near the bottom or the top of the screen, or you're welcome to enter information into the chat box. Nikki, are you able to see the chat in real time?
I can, yes. Thank you for that great information, Mary. We have heard about the UCSF program and it's fantastic.
Yeah.
Well, if anybody does have questions or if anything comes up from our discussion today, please feel free to reach out to the email address that's on the screen, and Lauren and I will be happy to get back to you.
Yeah, and the other thing is, I know that we're always looking for feedback on the programs that the Integrative Wellness Center offers. So if you would be so kind and you're willing to enter your email address into the chat, we can send you a survey of your thoughts on today's presentation.